Hello everyone and welcome to the N.A.R.C.N network. This is going to be part 2 of episode 215 that I was just doing, and we're going to continue on from where we were in part 1. We're discussing in these particular episodes disorder confusion within the confines of narcissistic disorder. Now, what I was saying in part 1 here was there's or I should say, I've been noticing a lot of experts or people who study behavioral disorders, in particular avoidant disorder. And I've seen quite a number of, again, what we consider to be experts on the internet in avoidant disorder. I myself have studied avoidant disorder as part of my narcissistic disorder studies. So I do understand avoidant disorder and the different forms of it quite well, I think. Not to mention, I also study some of the preeminent psychologists like Professor N.A.R.C.N and Jordan Peterson, who also have a very wide berth on understanding avoidant disorder themselves. And I'm aware of those psychologists' viewpoints on that disorder, and as I've stated before and in the last video, Professor Sam Vaknin is one of the godfathers of psychology as far as narcissism goes. And I know his particular ideas on avoidant disorder because I've studied him quite thoroughly over the past 5 years especially. That being said, one of the things that is bothering me and seems to be affecting other narcissistic disorder experts that you can find on the internet, especially on places like YouTube, is that there seems to be a dumbing down of narcissism. Now, it's almost like being a narcissist has become even more taboo than it was before. And not that anybody likes to be tagged as a narcissist. Nobody wants to be picked out as being a narcissist or as having narcissistic disorder. But if that's what you have, that's what you have. Let's call a spade here. Now, some of the other disorders that go along with narcissism, we've talked all about the attached disorders on the N.A.R.C.N network before. There's a great many of them. Most narcissists have anxiety disorder. A lot of them have bipolar disorder. These are all attached disorders that we see right along and in an overlapping way with narcissism. And there can be like over a dozen attached disorders that can go along with having narcissistic disorder. Avoidant disorder being one of them. But one of the things I've noticed myself here is that there seems to be a lot of experts talking about avoidant disorder, presenting on in their videos or in their presentations all the things that are attributed with avoidant disorder, or all the red flags that go along with avoidant disorder. And when I look at these red flags that go along with avoidant disorder, I think to myself, they're just describing a narcissist. Now, granted, some of these people that study avoidant disorders or consider themselves specialists in avoidant disorders have to be aware or understand that there is overlap always and very often in associated disorders like being bipolar or having antisocial personality disorder. There's always another disorder that goes along with that as like a carrier type disorder that's carried along with whatever else is going on with that person. And this is true in probably 90% of the associated different disorders within the confines of narcissism, but within the confines of that group spectrum of disorders as well too. So you're going to see some overlap with disorders. But these particular people who I've been watching very carefully on the internet, as well as one or two other people who present narcissism videos besides myself, one of the things that they are also noticing is that it's almost like the people that they're talking about, or the individuals, the patients, whatever, are presenting with all the key red flags of a narcissist, but nobody is talking about the factor that that person presents with a dozen narcissistic red flags, and yet you're psychologically tagging them as being an avoidant personality disorder. They may have avoidant personality disorder tagging along within the confines of their narcissistic disorder. About 99% of narcissists do have avoidant disorder related to this, because as we've talked about in previous videos, the narcissist has this behavioral thing that they go into with you where they engage with you, they love bomb you, they pay tons of attention to you, and then they disappear. And they don't talk to you for 3 days, and or a week or whatever, and then suddenly they come back and they engage with you again, and then suddenly they're gone again. Like this. This is part of their avoidant behaviors within their narcissism, and it does classify in there along with avoidant disorder behaviors. This is part of that. But you're also seeing, you know, a bunch of different other behaviors that are indicative of the factor that that person is showing narcissistic personality disorder traits or red flags. Yet you have these so-called professional people on the internet tagging these individuals as just having avoidant personality disorder. But I can see in the confines of this, and it's not just me, it's some other experts on the internet too, some of which are psychological professionals, like of a high degree PhDs and all kinds of stuff related to that. I'm just a guy here on the internet making videos about narcissists because I had experience with narcissists. Yes, do I have some psychology understanding? I do, because I studied criminal psychology in my 20s with the idea that I wanted to go into into policing, to possibly do something of that nature in the confines of criminal investigation. So I studied all kinds of stuff, serial killers, people who are just behavioral psychopaths and everything in my 20s. And over the past 5 years, since I had some narcissistic events, I've started restudying all the stuff to do with narcissism and all the associated disorders. So though I don't have any PhDs in anything, I know quite a bit of shit here. And most of the stuff that I learn from professionals. I'm learning out of psychology books. I'm reading the books. I'm reading all the medical manuscripts that come out constantly on psychology and stuff. I'm being as up to date as I can on a weekly basis with what's going on in psychology and going on. So I'm not just a blowhard person sitting here that has no idea what the fuck I'm talking about. I do have an idea about some of this stuff too. Pretty solid idea, actually. That being said, I'm seeing these people talk about avoidant disorder personality people and describing them and describing all of their actions and all the things that they're doing, and I'm looking at this going, you're just talking about narcissists. You're talking about a narcissist that has avoidant characteristics here. You're not talking about an avoidant person that has some other attributes in there that are like this. It's almost like everything is having to be sugar coated lately because of, I don't know, the foo-foo unicorn movement going on or whatever, and nobody wants to say anything negative to somebody else. Fuck, let's call a spade here. I'm seeing all kinds of this on the internet, and this type of dialogue to individuals, even psychology experts, who are openly tagging people with having a disorder that is clearly, to me and to others around me who study narcissism, these are clearly the red flags of a narcissist who has some avoidant attachment in their behaviors. Yet they're being pulled out as an avoidant, only as an avoidant, never mind being pulled out or being tagged as a narcissist. What the hell is wrong with psychology people out there who are not seeing this? I mean, I have this example with a few people that I know who have been diagnosed as being bipolar. Dude, you know, I question the competency of some psychologists here, or are they just too scared to pull somebody out and tag them as being a narcissist? Because that's what they fucking are. You know, I almost like this. This bugs me to. I'm finding words hard to find to describe how annoyed I am with some of the content I'm seeing on YouTube and stuff about people talking about other disorders, in particular here, avoidant disorder, and tagging people as avoidants when they're clearly not avoidants. These will be behaviors that they're describing here. There will be a dozen behaviors that are indicative of somebody who is a narcissist, and then there'll be 8 behaviors of a person that is an avoidant attached with that dozen behaviors of a narcissist. Yet you're tagging this person as being an avoidant? Like this, they're not an avoidant. They're a freaking narcissist with avoidant things mixed in there. What is wrong with psychologists right now? What is wrong with people doing? I don't understand what's going on with this, and I'm not the only person studying narcissism who's annoyed with this. By all means, if there's anybody out there watching this video and has come across the same stuff I have, as well as some other narcissistic study people who are on the internet here, who have the same view as I do, like, what the heck is going on here with this? It's like, are these psychologists not seeing what's really going on with their patients? Are they not seeing that, you know, that this related thing is related to something else? Because I can tell you right now, and we may have a part 3 of this video here because I'm kind of running out of time in this particular video, but when it comes to this, you can't ignore the red flags as being red flags of a narcissistic person. Yes, avoidants have some similar red flags too. But when you look at those particular red flags an avoidant does, those red flags are also the red flags of a narcissist. And I think what we're going to do here is we're going to go, I'm going to do a part 3 to this, and we're going to talk a little about some of these red flags that are common in between narcissists and avoidants, just as an example, so you guys can see this, because I find this really disturbing that this is going on the internet, and that we're seeing this type of behavior with psychologists who should know better. Either they're not schooled well, they're not reading the same things, they're not studying as wide a berth as I am of this. I don't know what the heck it is. But again, I'm not the only person studying narcissism who's noticed this on the internet. There's a number of other people who I don't want to name in particular necessarily here. But you can find out this information from them. And if you go look on, just say, for instance, Professor Sam Vaknin's website or on his YouTube page, and you type in avoidant personality disorder and narcissism, he's got a ton of videos that where he talks about avoidance and narcissistic people, and how avoidant personality disorder is just a subcategory of narcissism. Anyway, we're going to talk more about this in part 3 coming up. I'm going to let you guys go in this video. Stay tuned for part 3. It's coming right after this one, and we'll continue on a little bit more and talk a little bit more about this.